Welcome to the Green Wisdom Health Podcast with Dr. Stephen and Janet Lewis, where you will learn about natural solutions to common ailments. And now, here are your hosts, Dr. Stephen and Janet Lewis.
Hello and welcome to this week's edition of the Green Wisdom Health Show. I'm Janet Lewis.
And I'm Dr. Lewis.
And today we thought we'd put a little bit different spin on something for you. We know you guys are real concerned about immune system this time of year, also about extra stress, and because we're still trapped in this 2020 year, stress has been a very big part of it. But, you've heard of the regular things for helping those kind of things like elderberry and, zinc, that kind of stuff. We've talked about it before that, those kind of things are really good for immune system. But one thing that's probably way overlooked and probably a big root to helping you have an immune system and deal with stress are probiotics. And I know that sounds odd, but Dr. Lewis is going to tell us the connection of probiotics with stress and immune. So this week's show is called Probiotics for Immune System and Stress. Wasn't that original? So Dr. Lewis, what the heck are we doing with probiotics? That's not like taking zinc and things we know build immune system. How do probiotics correlate for health?
Well, it has almost everything to do with health. There's all kinds of things that will add to health. Some things go through my mind. I can't speak, but you've heard of gut leakiness and things that lead up to inflamed endothelium and inflamed intestinal lining by toxic environments and bad diets and all that kind of stuff. Well, it's just so much easier just to let the probiotics take and run with it, and you should remove the toxins and the offending materials, but you have to repair the gut leakiness, but you've got to re-inoculate with these probiotics. And re-inoculate, people say, well, when are you done with it? And I think never, because we live in a challenging time as far as the toxins go and as far as the stress goes. And the stress, a lot of that's just created with our mind and our spirit, but it's easier to let the probiotics work on the environmental part.
Well, and what we thought we would try to do is, because we literally have probably 7 or 8 different probiotics, and when people come in here, we ask them, well, do you have good bowel movements? Do you not have good bowel movements? Because there's some specific for helping you go to the bathroom better, and then there's some that help people that go too much not go so frequently. But as far as different emotional aspects of it, I don't know that we've ever really discussed that, because that's just not something we generally think of to say, hey, well, how's your emotional situation whenever they come in? Maybe we should start doing that. But I thought I'd just kind of tell you some different things about the different ones and how they correlate to what product we have, so you have an idea of what you might be trying to achieve, what you're looking for. Does that make any sense? Like boosting cognitive function. There's probiotics that can help maintain your brain function, such as boosting spatial and non-spatial memory, because everybody's trying to work on their memory, as well as managing anxiety, depression, autism spectrum disorder, and obsessive compulsive disorder. So you probably didn't realize that there are probiotics that actually deal with that. The ones we use for that is something called Probiotics, and we also have another one that's called Probio Complete, and that's the ones that those are different ones than what you generally have heard of. One you may have heard of that we do talk to you a lot about is something called Target GBX, because it does more things that are associated with like a sad mood, brain behavior, and immunity. It kind of does everything all in one. So Dr. Lewis, could you tell us a little bit about maybe what Target GBX does, why we use it?
Well, and yeah, that's the one I thought Janet was talking about, because when I get a little bit fun to live with, she hands me one of these little sachets and says, here, take it. It's got some super researched different species. It's got the Lactobacillus casei, but it's a specific brand of that, so to speak. It's got the acidophilus, the brevis, the lactis, bifidobacterium. One that's really important is Lactobacillus salivarius. And for the people that have chronic bad breath, that's a really good one for that. And salivarius, think of salivary glands. It's got some others in it that are really, really good. I can't believe how well it worked because I just roll my eyes. That's a typical Lewis thing. You roll your eyes in disbelief because, God don't like ugly, so we just roll our eyes instead of being ugly. There's so many probiotics, and you've got to understand you've got about 100 trillion microorganisms in our body, and you have to keep the more noxious or toxic organisms from colonizing in your guts. And to do that, you have to reintroduce these good bacteria every day. And when I talk to my patients, I say, well, I put you on this one, but you need this one and trade them off. And I'm most nights I'll take 2, 3, 4 different types just because you'll introduce different species in there. And the reason you want to continue to reintroduce it, for example, yesterday Janet ate some chicken in a very nice Japanese restaurant, but the chicken probably has antibiotics in it, and we know chicken has arsenic in it, and all of that challenges the good bacteria's ability to colonize in your GI tract.
See what fun he is going to eat lunch with him. I never thought about that when I ordered that yesterday, but you're absolutely right. But how do we... there's really no way to not get that kind of stuff if you're eating out at all.
When she says I'm fun to go have lunch with, that means bull. That is not. She kind of has a problem. We were watching one of my favorite movies the other day, and a guy had 2 6-shooters, which they usually had 5 loaded for safety reasons, and he shot 12 times, and then he shot another 12 times without reloading. And, of course, I had to say something, or, they'll pick up a Glock and it'll click. And it's like, I've got 3 or 4 Glocks. They don't click when you pick them up. And one of our patients helps make movies, and he goes all over the world doing it. And he's one of the special effects guys. I said, well, why don't you ever show a reload? He says, Doc, we do. He said it gets edited out. So, my apologies for being detailed and specific.
Analytical, yes.
Analytical. Well, she calls me something that starts with an A sometimes. Maybe it's analytical. But, the bacteria, the good bacteria, have a lot to do with maintaining the integrity of the intestinal lining. And I don't care what's going on in your life, whether it's lack of energy, mitochondrial dysfunction, whether it's mood swings, whether it's overly stressed, and that could be anxiety, depression, sadness, impending doom. Think about probiotics because they really do make a difference, but you have to continue to put them in so that they can eventually take over. And Candida is a big, big, bad yeast. And those books have been written. You've heard me talk about it.
Well, when people go to the store, I think most of their goal to get a good probiotic is they're looking for something that's got a lot in it. That's what they always say. Well, I'm getting a strain that has this much in it, and I got it out of the fridge. Can you dispel about why, amount of it is not necessarily what you're looking for? I mean, a high amount of it. How do you have some that are shelf stable? How are they any good if they're not in a fridge?
Well, some people come in and they've read something on the internet and they're just convinced that they know, well, this person says this. And it's like, well, yes, but there's always an exception to it. They say, well, if it's not refrigerated, it's not any good. That's not true either. There are some room temperature shelf stable things. And people say, well, it's got 50 billion in it. It's like, well, if you put these things in a petri dish under a microscope, if you knew how many of them did not come to life, you'd think, holy cow, I've been wasting my money. If you knew how many was really counterfeited, yeah, you'd be surprised. So you have to go to companies that you trust, which is what we do. Genes are genetic expression and DNA function are absolutely critical. They have a very symbiotic relationship to what's going on with the probiotics itself. The GI flora, gastrointestinal flora, It's been studied by people like the National Cancer Institute. Let's see, one of the things, I got some notes here. It says, condition of the intestines affects the production of butyric acid, which is critical for acetylation in the liver. That means detoxification. So as you're building up the good probiotics in your GI tract, you're increasing your ability to detox. When I say it's critical for gene expression, there's plenty of people, we can't make any claims about supplements doing anything because of the FDA, but there's plenty of big entities that say you have a greatly reduced chance of cancer if you take, if you have good GI flora. Let's just put it that way. And it comes from places like National Cancer Institute journals and places like that. Toxic intestinal bacteria can produce stuff like interleukins, which is a very inflammatory chemical. Now, that's from Journal of Immunology, so we're talking about immune system here. And who is not aware or considerate of, well, how's my immune system kicking? Less healthy gut bacteria can cause sugar products to stick to the cell membranes. That in itself adversely alters genetic expression, and then babies end up having immune problems, and especially babies that are born by C-section, because normally when they are vaginally birthed, you get inoculated there. Then there's studies that say, well, we take obese people and then we take healthy thin people, get the fecal matter from the healthy thin person and inject it into the colon of the obese person, and they begin to lose weight because it's a different type of bacteria. I think it's Firmicutes is the fat building bacteria, and Bacteroidetes is the ones that if you get up around a 70% ratio, you begin to lose weight. And we've seen this in many people that do what we tell them to do, and they're considerate of the fact that it takes time. That's the hard part to get past. It really does.
Which probiotic are you talking about that helps with that?
Well, the ProBioLean is for that, and if you don't need to lose weight, you should do it anyway. I'm like, okay, I'll try it, and I lost 7 or 8 pounds in 2 weeks. I didn't change my diet at all, and I'm 5'10", 5'11", depending on who's measuring me, and 180 pounds, 178 to 180. And I started taking this ProBioLean, so, I wasn't exactly super overweight. And I lost 7 or 8 pounds. I'm like, okay, well, I guess this stuff works. Well, one of the things in it, and really there's a lot of them, but it has something in it called Lactobacillus gasseriae, and that is one that's been studied to help you lose weight. And probiotics help clean up cholesterol. So, I'm not a big worrier about cholesterol. I'm more of a worrier about, hey, let's fix what's causing it to go crazy anyway. So probiotics are real easy. And I put people on ProBioEase if they have gut issues because it does not have inulin. And people come in and say, oh, it's got to have inulin. Does it have inulin? Because they've read it on the internet. It's like, yeah, but you don't really understand the whole deal. If you've got gut problems, do that. Because when the inulin starts to ferment, it'll give you gas and bloating and
and that's why
noxious to be around.
And that's why we specifically have one made that does not have inulin, which is the ProBioEase.
Yeah. And that's a really good one. But then we sell the heck out of ProBioLean and ProBio Complete. And it's like, well, you can't make a bad choice. Again, I may do 2, 3, 4 different types. And one thing I don't think we plan to talk about it, but since I mentioned Candida, one of the best things to do is just take your Saccharomyces Boulardii. And if you understood what that does, it's a pretty kick-butt, good probiotic yeast. Does not colonize in the guts, but it grabs the bad guys and carries them out when you have bowel movements. So that's pretty important, I'd say.
Yeah, so the Saccharomyces actually helps with consuming bacteria-contaminated food. It helps with people that are exposed to viruses and parasites, and people that have taken medications such as antibiotics and acids. And that's probably one of our biggest, just the fact that when somebody has done antibiotics and they've gotten out of a hospital and they look like they're going to die, which we've had several of them that's their spouse has brought them into our place.
They're corpses, but they're still walking around. It's like, man, you better take this stuff and take it hard and heavy and fast and pray. And I'm saying that literally. Pray that God blesses it.
And then it miraculously brings them back. It's like it is awesome. Yeah. I think the probioline, you talked about for losing weight. Also, there are people out there that don't really need to lose weight, but they may have a blood sugar problem.
Yeah, I do it anyway.
Right, because that is one of the reasons why they lose weight is because their blood sugar starts being controlled, which is why they gained weight to start with. But people that are like having hangry pains in the morning because they haven't eaten anything, probioline would be a great probiotic because it does help stabilize blood sugar.
I got the stink eye when she's talking about blood sugar. Some of the benefits of having your microbiome balanced is usually weight loss, and I know it's a tough thing for some of you, but some people, I'm not losing weight. Well, I know you drink a bottle of wine every night, and I see you out there eating the heck out of carbs. Let's get realistic, because I've got dozens and dozens and dozens of people that do lose weight, and it's usually pretty fast and dramatic if you take your diet seriously, but you have vastly improved mental focus, better emotional state, better energy levels, improved responses to stress. It's not that stress doesn't hit you every day. It's just that you're not adversely affected by it, and you just have the peace of God. It does help your immune system. It helps have beautiful glowing skin, because what you have on the inside reflects on the outside. We've had quite a few people that had restored hair growth, but for the just generally renewed sense of vibrancy and vitality. That's generally, once you get enough probiotics in long enough, that's usually what you have.
And speaking of, Dr. Lewis is watching you out there, what you're eating. We're actually having an app developed, and our first program in it is going to be for weight loss. Dr. Lewis is all about, I'm not holding your hand while we're doing all this stuff. Well, his new app is going to be called Dr. Lewis's Hand-Holding Weight Loss.
And I'm going into it kicking and screaming because I'm like, oh, good God, just quit eating that crap. So we got a visit the other day from Melissa from Virginia and her beautiful sisters and drop-dead gorgeous mother. They're from Florida. And so we're allowing. Melissa is kind enough to do some experimenting. We put together a package of things.
Right, to help with weight loss, and what it's also going to do is it's going to give you meal ideas. It's going to help track your movement. It's actually going to have a place that is available for Dr. Lewis to answer your questions as you're going through it, because he is going to hold your hand through it.
Like I need one more place to go or one more thing to do. But the one reason I expect this to work on Melissa is because she does have a spiritual background and she does know how to apply her faith. And that's very, very important in having a healthy life, not just healthy physically, but healthy mentally and spiritually also. So
look for that to be coming in the next few weeks or so. Where I think it's gonna be a 28-day program. It's like $27. It's super inexpensive, and when the 28 days are over, you will still have your recipes in there of what to eat. You'll still have a lot of the tracking information that's in there, but it's a
way to track your bowel movements and how they look and are they good.
Yes, I'm excited about that. It's what do they look like?
I call her the poo-poo doctor. Trains in, trains out.
That's what had me. So it had me at bowel movements. I thought this is just awesome.
She's kinky.
Yeah. Also, you briefly touched on some things that help with breast health. I think you talked about kids, and how they could get probiotics. A lot of expectant mothers out there, a lot of mothers that are breastfeeding, have probably never thought about taking a probiotic where it could be given through the mother and come out through the breast milk.
You're boosting your baby's immune system if you're dealing with probiotics. That one's called Target B2, and it just has Lactobacillus fermentum in it. But the fermentum increases calcium and magnesium and some other mineral utilization and uptake.
B2 and B12. Mm-hmm.
Oh, B2. Oh.
It also helps with zinc and phosphorus,
which builds immune system too. So now, if my advice to lactating mothers is, yes, you need to take this, and I don't think that's the only one you should take, but I think it's incredibly important. But for those that need the uptake of these minerals, even osteoporotic sweet little old ladies need to take it too, because it's going to help with your mineral uptake and bone health.
Yeah, that's funny you mentioned that.
Oh, she's going somewhere.
I was actually going to tell a story about bone health. We had a patient that came in. Her name's Teresa, and she asked me to share this on the air with you guys about her bone density test that she had taken. She said her doctor had given her 2 different prescriptions to take because she had the beginnings of osteoporosis about a year ago. She got one of them and thought, it was a lot to do, so she didn't do it. She took it back. They gave her a different kind, and she was still really scared of it, and that was about the time she started working with us. And she's trying to target which thing did it, but we are pretty sure it's our vitamin D 5000 that you always hear Dr. Lewis talk about, with the extra added K2, because the K2 helps you utilize vitamin D. And she went back for her exam to see how her bones were doing this year, and she passed. And the doctor said, "Oh my gosh," she said, "this medication I've given you has really worked." And and Teresa said, I hate to tell you, but I never took it. She said, "I just couldn't bring myself to do it." And she said, "Well, what did you do to do it?" And she said, "Well, I've just been doing some natural things down at Green Wisdom Health." And she said, "Oh," she goes, "Well, I'm not really sure what did it then." She said, "But," and Teresa said, "So do I still need this prescription you gave me?" And she said, No, you don't need it, because you don't have it anymore." So she wanted me to share that on the air, that sometimes natural things can actually work.
Well, they do work. Again, we can't make claims per the FDA, but if you put it in, your body has a wisdom about it. And I'm not anti-drug. I love our medical profession. They bail me out several times in good ways, but we're the pretty much the sickest society on the face of the earth. So, I'm going to give you a list of things that if you have these, and I tell people, be cautious about diagnosing yourself off a list, because diagnosis is a calamity at best, says Dr. O'Mara. Rest in peace, please. But this list is if you have abdominal pain, aging too rapidly, and I'll look at people I grew up with, and dadgummit, it's obvious that these supplements are working, because I'm young, rich, and good looking as I get older. I'm full of crap too, but anal itching, allergies, anxiety, arthritis or achy joints, bloating, gas, brain fog, which is usually yeast stealing your thiamine, constipation, depressed mood, diarrhea, difficulty focusing, which, can be incredibly stressful anyway. Dry skin, eczema, fatigue, when you feel too full, or the food's just sitting on your stomach, so you have to have lunch with Janet, because she will drag the digestive enzymes out. If you have hair loss or dull and lifeless hair, and it's like, well, Dr. Lewis, if that's an imbalanced microbiome, I heard that also on thyroid list. Yes, that's why you should not diagnose yourself.
But do lab work.
From the list. Mm-hmm. Yeah, the lab work takes a lot of the guesswork out, because guess what? Sometimes an apple a day is not enough. But chronic headaches, infections, can't get well like you should, the joint pain, lightheadedness, I think that's probably a lot of toxins too, or food sensitivities, low energy, memory problems, muscle pain, nausea, poor skin color, rashes, sexual dysfunction. Golly, it's amazing to me the people in their 20s and 30s that are having sexual dysfunction.
Well, and we had a question from Valerie that wanted to know about chronic yeast infections as well. So sexual dysfunction, yeast infections, I don't know. But she wanted to know, is there something that you can do that's natural instead of having to do an antibiotic every time you get a yeast infection? And one of the probiotics we wanted to actually tell you about is one called UT Health, and we have it for vaginal health. It actually helps.
And urinary tract, too.
Yeah, in urinary tract, even for men. So it's not just for women, but
right.
It actually helps you not have to be on an antibiotic from now on for yeast or urinary tract infections. Also, we have another product called D-mannose. That's a bacteria that the bad bugs like. They will actually...
It's sugar.
It's a sugar.
Sugar that runs through.
And the bad bacteria actually comes out to eat it. And when they come out to eat the good sugar, they get flushed. So there are natural things you can do because the antibiotics are consistently killing your good probiotics. And Dr. Lewis always talks about how long it takes to regenerate good probiotics once you've done antibiotics.
It depends on what you read. That's like all the research out there. They say 2 weeks to 2 months, and then there's others that say 2 months to 2 years, and then there's other research that says you never totally reestablish it. And that's why I tell people you should always do it. I personally think the 2 months is overly optimistic, and the 2 years is probably much more realistic. But again, I do probiotics pretty much every day, and I still stir that Saccharomyces Boulardii in my drink.
Which I want to make sure we answer a question while you're on the antibiotic thing. Rich had a question. He said as part of his cataract surgery recovery, they've given me antibiotics via an eyedropper. Do those cause as much harm as oral antibiotics, or is it localized due to the nature of it being delivered into the eye?
I think it's localized. I don't think it does the damage. And for goodness sake, you need to always follow your doctor's advice. You know, we can always clean up whatever has to happen. I've taken antibiotics. It's like, well, it's not a big deal. Sometimes they're a lifesaver, and sometimes it's just a shortcut to getting well. You know, because our immune systems are so suppressed and depressed, antibiotics can really be a good thing, but you want to hit the probiotics very, very hard and very quickly.
Again, doing something like Saccharomyces Boulardii behind a round of antibiotics really does.
Or during, because antibiotics doesn't adversely affect them, where we tell you if it's a bacteria probiotic, you want to start after you cease the medication, the antibiotic.
Oh, very interesting. Would they, if they were on an antibiotic and wanted to add in Saccharomyces, would they just take it at a different time of day? Or
you know, it doesn't really matter, because antibiotics are, you know, designed to adversely, you know, they're for bacteria. So Saccharomyces being a yeast, a good yeast, doesn't matter.
Oh, see, I learned something from you, and I'm around you all the time, but then there's little nuggets that just trickle out that y'all all get the advantage of hearing.
Yeah, but she's assuming I'm telling the truth, too. She's assuming it's correct.
That sounds really good. Can you talk about the effectiveness of probiotics for kids? Why is it so important for a kid to have really good probiotics? And what kind of probiotic, I guess, would you recommend a child take? You know, we always try to... You know, people are trying to give them a multivitamin.
And we finally have one that's grandkid approved that they'll actually take. My finicky little grandson, he's actually taking them. And so it's like, oh, they're not this crappy high fructose corn syrup sweet stuff that you can get that's jelly. Like,
we'll leave it at that. Jelly
What was the question? You know, it helps with mental acuity too. Maybe I need a dose of them.
Yeah. What kind of probiotic would you recommend for a kid?
The Target GBX is really, really good because it has a lot of different types in it. My sweet little granddaughter likes some other ones, and you know, you can just open a capsule and sprinkle it over something that they're eating, and she calls them her little Papa's little magic unicorn sprinkles, and then it works.
And then also for the kids, if they have sore throats, we have one called Probiotic ENT.
Yeah, that's a really interesting one. It's a Streptococcus something, I forget the other part of it, but it fights the bad streptococcus. And, you let that tablet dissolve in your mouth, and the bad streptococcus get their butt kicked by the good streptococcus. And I've had people within 2 or 3 of those tablets dissolving in their mouth say, oh, my God, my chronic sore throat is gone.
And that's for adults, too, not just children, correct?
Yeah, we keep it in the fridge just in case we start to get a sore throat. And that's to keep the bad strep from beginning to grow.
And again, we cannot stress enough, do your lab work. If you're due to have lab work, again, it's a good time to do it because you're headed into some winter, dark months now. We have a lot of people that are doing their lab work now at the end of the year. Trying to make sure that they're as healthy as they can be going into next year. If you're not familiar with our lab work, go on our website, greenwisdomhealth.com. Fill out our health survey. It will recommend you a lab panel, and you'll be able to purchase it right from there. We can do it in almost 50 different states, and then we will give you supplement recommendations based on that. It's about the lowest cost you're going to find for it. And with that, we have come to the end of our show, but Dr. Lewis likes to always encourage you with some uplifting words for the week. So, Dr. Lewis, what would you like to share with us during this week?
Well, I tell people sometimes ain't no education like there is in the kick of a mule. And that means don't wait until disease comes up and slaps you on the butt. You can get preemptive if you were, smart, I think. And don't just sit there dumb, like grinning like a possum eating fire ants. That's enough southernisms. To get healthy, be grateful, be thankful, do things for other people. It does more for you than it does for the person that you're blessing. And always remember, sometimes the best form of transportation is your leap of faith into better health.
And with that, you guys have a blessed week. We'll be here next time on the Green Wisdom Health Show.
Once again, our show has come to an end, but your hope in your health is only beginning. If you or a loved one are in need of a different outcome and are waiting for a brighter future, take the first step and go to our website and fill out the health survey. Please don't keep us a secret. If you know someone that could benefit from this podcast, please share this show with your friends and family. You are only one step away from a life worth living.